Hi, my name is Claire Nastasius. I chose to do my presentation on the art of mindfulness. So the history and origin around the practice of mindfulness originated from the Buddhist religion. And historically, the culture and people that surrounded this practice were from India and Nepal. It has been practiced for thousands and thousands of years in a religious context, most predominantly in the Buddhist religion, but now it is practiced as just an everyday thing. It's not necessarily related to any religion, or it doesn't have to be. It can be independent from any religion. How it integrated itself into Western medicine was through John Kabat-Zinn. He founded the Stress Reduction Clinic and the Center for Mindfulness in Medicine at the University of Massachusetts Medical School in 1979. And he was a big turning point for mindfulness being more commonly practiced, especially here in America. He also founded the mindfulness cognitive therapy and stress reduction therapies. So just going along with the origin of mindfulness, here's a picture displaying some of the things that go into the Buddhist religion and mindfulness specifically. So what exactly is mindfulness? It is the art of focus and being in the moment enough to control your thoughts. According to the book that our course is using, it is, quote, the opposite of living on automatic pilot. It is the art of conscious living by focusing full attention on the activity at hand. So it is being very present in your mind, focusing on one thought at a time, and being very controlled in your mind. So how exactly does it work? Instead of just making points, I thought that picture was kind of nice, and it seems peaceful in ways. So it works by focusing your mind and controlling your thought. It helps one be present in the moment and significantly self-aware so that one can let go of negative, unhealthy, frustrating thoughts. It works by allowing you to be introspective and let go of stress and thoughts that are overwhelming you. Specifically, mindfulness is a part of like a meditation practice. It's not necessarily an independent practice. It is part of more of like a meditation practice. It could be part of yoga or any other stress reduction programs. So benefits and contraindications of mindfulness. It really helps improve mood by decreasing stress and anxiety, and also depression. It actually can increase your immune function. It can lower blood pressure and heart rate, seemingly through just being able to reduce that stress and by being able to focus your mind. It also can boost creativity and strengthens the brain function. And as far as contraindications, there are really no known contraindications to practice, and anyone can practice mindfulness. It can also bring just this internal calm, and an experience of feeling relaxed and peaceful. So advantages and disadvantages, again, instead of just listing things out, there's not a whole lot of disadvantages to the practice of mindfulness, and that's why I put this fun picture that says #winning, because a lot of the advantages, like I already previously mentioned, it can help you physically but also emotionally, and helps give people peace and relaxation. It decreases stress feelings that typically you could be overwhelmed by. Really, the side effects are minimal. They there's really no negative side effects necessarily. The perception of mindfulness, technically just integrative medicine in general, has become more and more popular in recent years, and the appreciation for holistic treatment for mind, body, and spirit has also become widely accepted. Many people have begun to practice mindfulness, and that stems back to the man that I previously mentioned, John. So, to see a research article as far as just the benefits of mindfulness, I looked up a research article that was regarding how mindfulness impacts cancer patients, and this specific article was talking about women who were breast cancer survivors, and then they were placed in a randomized control trial. There was groups that went to 2-hour sessions of mindfulness for 6 weeks, and then there was a group that didn't go to those mindfulness classes. And at the end of those weeks, and then also at 3-month follow-up, they tested several different things by having the participants answer questionnaires and things like that. And physically, it actually decreased inflammatory markers that they measure regarding cancer and everything. And then emotionally, it increased the feelings of peace and meaning for the cancer survivors as reported by them. Also, there is a lot of research out on the practice of mindfulness, and it can be in regards to job stress and decreasing job burnout. It can be in regards to substance abuse and how it might decrease addictive behaviors. And there's a lot of research out there, but I just specifically decided to focus on how mindfulness impacted cancer survivors. Because there's so much research out there, I just decided to narrow it down to one research article. And then just for a personal story, I found this on YouTube, so we will listen to Jane's story and how mindfulness impacted her.
I was diagnosed with breast cancer in 2004, and then I've had a few more lots of treatment for secondaries, and now I'm what they call metastatic breast cancer. I approached the course thinking that I would get more of a, not necessarily a structure, but an ability to sort of be able to manage those different thoughts and feelings, because I think the mind can take you to so many different places, and it's being able to recognise that and then sort of rein it in. It's beneficial with cancer because your mind, and particularly in my situation where the cancer has come back, your mind goes in all sorts of directions at all sorts of times, but by being able to recognise that that's actually what's happening, these thoughts are taking you to different places, then you can actually have a bit of, I wouldn't call it control, but you are actually recognising what's happening, and you can perhaps do something about it and lower that stress. But I've probably explained it in terms of what I've got out of it, and that is that to be able to try and be present, you can actually then manage the fact that, all these things might have happened already, and then things might happen in the future, but for the moment, all you can do is be here. It sort of has that ability to be able to, whether you're a cancer patient or not, I think it's a useful way of being able to deal with life.
So that's just a neat personal story from Jane, and I like what she said, that even if you're not a cancer patient, the practice of mindfulness just helps you deal with life. And I do think that our minds are super powerful, and our thoughts are, and so just being very self-aware and intentional about what we're thinking about, and taking that time to silence ourselves and be introspective and consider what our minds are thinking about can truly impact us. So I just thought that was a neat story that I wanted to share with you. As far as educational requirements, You don't need to be certified to practice mindfulness. There's many people who do it on a daily basis. And to teach mindfulness, there are a lot of different programs out there, most commonly like year-long programs that you can take, but there's several week programs that you can take to become certified in it, and it seems fairly accessible, at least from my research online, to become certified to teach mindfulness. So my review questions are, number 1, what religion did the art of mindfulness stem from? 2, who was responsible for bringing the practice of mindfulness to Western medicine? And 3, what are 3 benefits to practicing the art of mindfulness? So here are my references. I hope that you enjoyed this presentation. Thank you very much.